Would you ever wear someone else's prescription glasses, knowing they might make your vision worse? Probably not. So why do so many of us think it's okay to share prescription medications? Every year, thousands of people end up in the ER because they took medicine meant for someone else. It could be something as simple as an antibiotic or a painkiller, but what are the risks, if any? Well, there are risks. And they're serious. Side effects, drug interactions, even addiction. Hey everyone, it's Lucas here on behalf of DrTeddyRx with your 8-minute consult. Today we're busting 3 of the biggest myths about sharing prescription meds. We're going to look at the real dangers lurking in your medicine cabinet and give you the knowledge to make safe and informed decisions about your health. Before you help someone out by handing them that extra pill, stick around. You might just save a life. You know how doctors always say, don't try this at home? Well, that advice isn't just for stunts or home remedies. The same goes for prescription meds. They're not something to be taken lightly or shared casually. That little warning label isn't just for show. It's there to protect you and ensure you use the medication safely. The myth that one pill can't hurt is just plain false. Even a single pill can have serious consequences. Even one pill can send you to the ER, especially if you have underlying health conditions you might not even know about. It's a risk not worth taking. Here's the thing. Every prescription your doctor writes is like a tailored suit. It's customized just for you. It's made just for you based on your age, weight, medical history, what other medications you're taking, even your lifestyle. All these factors are crucial. Doctors don't just throw darts at a dartboard of medications. They carefully consider all these factors. They figure out the exact dosage and type of medication that your body needs. It's a precise science. When you pop a pill that was prescribed for someone else, it's like wearing a suit 5 sizes too small or swimming in one 5 sizes too big. It's not meant for you, it's just not going to fit right, and it could even be dangerous. The risks are real and significant. We're talking unintended side effects, and I'm not talking about a little drowsiness. These can be severe. We're talking about things like heart palpitations, severe allergic reactions, even damage to your organs. These are serious health issues. What if that pill you just took is metabolized by your liver and your liver's already stressed at the moment? It could lead to liver damage. Or what if you have a sensitivity to a certain ingredient that your friend doesn't? The consequences could be dire. Look, I get it. You want to help, but handing someone a pill from your stash isn't helping. It's potentially harming them. It's like playing Russian roulette with your health. The stakes are incredibly high. If you're feeling sick, if you're in pain, talk to a doctor. They're the experts. Go see your local pharmacist. They're trained to help you with your medication needs. They're there to help, always one phone call away, day or night. They can give you the right advice and the right treatment for your specific needs. Trust the professionals. Alright, let's talk about over-the-counter meds, those harmless-looking pills and liquids sitting on your pharmacy shelves. They seem innocent enough, right? No prescription needed, so they must be safe to share, right? Wrong. Just because you don't need a doctor's note to buy them doesn't mean they're risk-free. Even OTC meds can pack a punch, especially if they're not taken correctly, or if they interact with other medications you're taking. Think of it like this. You wouldn't mix cleaning products without checking the labels, would you? Mixing bleach and ammonia creates toxic fumes, and mixing certain medications can create a toxic reaction in your body. That decongestant you swear by? It might be totally safe for you, but for someone with high blood pressure, it could send their blood pressure skyrocketing. And those painkillers we all rely on, ibuprofen, acetaminophen, even those can cause problems if you're taking other medications or if you have certain health conditions. Here's the deal. OTC meds are medications, plain and simple. They have ingredients, they have side effects, and they can interact with other medications and pre-existing conditions. So, before you pop that ibuprofen or offer your friend that decongestant, take a minute to read the label, and even better, talk to your pharmacist. They're a wealth of knowledge, and they can tell you if it's safe to mix medications, or if there are any red flags you should be aware of. Remember, just because it's available over the counter, doesn't mean it's safe for everyone. Play it safe, be informed, and when in doubt, ask a professional. Your health is worth the extra caution. Myth number 3. Painkillers aren't addictive if you're only taking them for real pain. Let's talk about painkillers, specifically opioids. These medications are often prescribed for severe pain such as after surgery or for chronic pain conditions. These are the heavy hitters, the ones that are prescribed for serious pain. They are incredibly effective at managing pain, but they come with significant risks. And while they can be incredibly effective at managing pain, they also come with a serious risk addiction. This risk is often underestimated or misunderstood. Here's the myth we need to bust. Just because you're taking painkillers for legitimate pain doesn't mean you can't become addicted. Addiction doesn't discriminate. It can affect anyone. It can happen to anyone, regardless of age, background, or reason for taking the medication. The misconception that painkillers are safe, if taken for pain, is dangerous. Opioids work by binding to receptors in your brain, blocking pain signals and releasing dopamine, which makes you feel good. This process can create a sense of euphoria. Over time, your body can become tolerant to the medication, meaning you need higher and higher doses to achieve the same effect. This is where the danger of addiction begins, and as you continue to take opioids, your brain chemistry actually starts to change, making it harder and harder to function without them. This is a key factor in the development of addiction. This is how physical dependence develops, and it can happen even if you're taking the medication exactly as prescribed. The body becomes reliant on the drug to function normally. The scary part is that many people who become addicted to opioids don't start out as addicts. They start with a legitimate need for pain relief. They start out with a legitimate injury, a surgery, or a chronic pain condition. They are prescribed painkillers to manage their pain, and somewhere along the line, things take a turn. They're prescribed painkillers to manage their pain, and somewhere along the line, they cross that invisible line from physical dependence to addiction. This transition can be subtle and gradual. The opioid epidemic is a serious public health crisis, and it often starts with just one pill. Awareness and education are crucial in combating this issue. So, if you're dealing with pain, talk to your doctor about all your options. There are many ways to manage pain that don't involve opioids. There are non-opioid pain relievers, physical therapy, and other alternative treatments that can help manage your pain without the risk of addiction. Exploring these options can make a significant difference. And if you're concerned that you or someone you love might be struggling with opioid addiction, please reach out for help. Early intervention can prevent a lot of suffering. There are resources available and recovery is possible. Support groups, counseling, and medical treatments can all play a role in overcoming addiction. So, there you have it. The truth about sharing prescription medications. It's like sharing needles. Dangerous and potentially life-threatening. Remember, your health is your responsibility. Don't take chances with it. Be informed, be proactive, and always consult with a healthcare professional before taking any medication, even if it's just an over-the-counter remedy. And if you're ever in doubt, just remember this simple rule. When it comes to prescription meds, what's right for your friend might be wrong for you. Stay safe, stay healthy, and keep those prescriptions personal. If you're struggling with substance abuse, the Substance Abuse and Mental Health Services Administration (SAMHSA) can help. Its contact information, as well as that of the National Institute on Drug Abuse (NIDA) and the CDC's Opioid Awareness and Prevention Department, is listed in this video's description. What's a medication myth you've heard before? Drop it in the comments. Like, subscribe and share this video. It might save a life. The channel is always looking to partner with healthcare brands, pharmacies, or wellness companies. Let's connect. Until next time, stay informed, stay safe, and keep your meds to yourself.